There's so much information out there at the moment around the Covid-19 and booster vaccinations that it can be hard to tell what's fake news and what's the truth. Because getting vaccinated is one of the most important things we can do to keep ourselves and our loved ones safe, I want to talk about some of the most common myths and to give you some of the facts so you can make your own informed decisions. I've picked out just a few, but for more information I'd encourage you to visit www.snevaccine.org.uk, where you can find out all about where to get vaccinated, as well as a huge amount of other useful information. I don't need to be vaccinated because I've already had COVID. A recent study has found that people who have not received a vaccination could be reinfected as soon as 3 months after their initial infection. Remember, you can also carry and spread the virus to others, sometimes unwittingly if you're not showing symptoms. It's more natural to become immune by catching COVID. You risk being seriously ill, off work and potentially in hospital if you wait to catch COVID. By agreeing to get vaccinated, you get immune in a controlled way, and most importantly, you pick the time. I've already had both doses of the vaccine. I don't need a booster. A booster dose of the COVID vaccine helps improve the protection you have from your first 2 doses. It helps give you longer term protection against getting seriously ill from the virus. I've heard the vaccine can give you side effects, and I don't want the risk of being ill before Christmas. The simple answer is that it's much better to be vaccinated now and minimise the risk of becoming seriously ill at Christmas or at any other time. Some mild side effects are common and you could feel unwell for a short time. These include headaches, fever, some numb pain in the arm, but are usually mild and not everyone gets them. There's no point getting vaccinated if there's still a chance that a vaccinated person can get COVID. Getting vaccinated can help prevent becoming ill with COVID-19. While many people with COVID only have mild illnesses, others may be more seriously ill or even die. There is no way of knowing ahead of time how COVID-19 will affect you, even if you do not consider yourself to be at increased risk of severe complications. Vaccinations help protect you by creating an antibody response and without having to experience the sickness itself. I've heard some vaccines are better than others. Which should I have? Your first and second dose of the vaccine will usually be the same vaccine. However, your third dose or booster may be different. You cannot usually choose which vaccine you have. When you book, you'll only be offered appointments for a vaccine that's suitable for you. All vaccines in use and safe and effective regardless of which vaccines you may have had before. Research has shown all vaccines help to reduce your risk of getting seriously ill or dying from COVID-19 and reduce your risk of catching and spreading and protect against others. I've not had my first or second dose of the vaccination yet, and I'm worried I'll be turned away from the vaccination centre. The vaccination centres run under a completely non-judgmental approach and can help you if you've not had 1 or 2 doses of your vaccine yet. You can book your vaccination regardless of which dose or booster online, or you can visit a walk-in centre. For the full details of how to do this, please visit www.snevaccine.org.uk.